Let's now take a look at the latest COVID-19 figures, and I'm joined by our health and science correspondent, Jenny Walrond. Jenny, just bring us up to date.
Well, there have been some big increases in the number of cases in some places. Somerset West and Taunton up to just under 463 cases for every 100,000 residents. Cornwall and Dorset are above 300. Everywhere else above 100. And some more sad news today about the number of people who've died with COVID. Another 16 patients in our local hospitals, bringing the total number of people who've died in local hospitals to 803. And figures out today from the Office for National Statistics show us that in total, up to the 25th of December, 1,320 people in the spotlight area had died and had COVID listed on their death certificates.
Jenny, loads of emails coming in. You're going to answer some of them in just a moment. We've also got joining us live this evening, Dr. Bharat Pankhania. Thank you so much for joining us once more. Lots of emails from concerned viewers. If I may put this one to you first, about runners, dog walkers, youngsters gathering in local parks. There's a real concentration of people in public parks at the moment because they're out for their little bit of exercise. Are people right to be worried about these people?
Yes, is the short possible answer. And my reasons are, we've now got a new variant, which is a little bit more infectious, in fact, considerably more infectious than the other strain, the original strain that was in circulation. And therefore, even though we're outdoors, my advice would be, please don't mingle with people who do not belong in your group. And if you are in a crowded place, even if it is outdoors, do wear your mask and keep your distance from other people.
Dr. Bharat, Clive has had the first COVID jab. The second has been postponed. He's worried how well he'll be protected.
Oh, that's not much to worry about. Please be assured, because it is not a case of because you didn't receive the second jab, you will now not be protected for long enough. And after all, it is programmed that you will get your second jab around the 3-month period. Some of them are getting it before the 3-month break. So please be assured. The good news is, Clive, you have been immunized, and that will hopefully protect you from severe illness. And that's the game we want to play. Protect as many as possible, as fast as possible with the single jab, so that they don't get severe illness, so that we keep them alive.
And I must just ask you very briefly, in terms of the vaccine and its rollout, when can lockdown end, in your opinion?
Well, the lockdown will end when we can immunize a sufficiently large number of people. That's all the vulnerable people, as well as the 18 to 60-year-olds, 65-year-olds who are economically active and now immunized. So until we've done 50, 60, 70%, we may have to go on to 80%. We will have to continue to take precautions. But the benefit is, once you've started to do about 30 to 40%, you will start seeing the benefits coming out of fewer case numbers. But we must continue to immunize as many as possible. And to be honest, I don't think we'll be back to lowering of restrictions until towards the end of summer 2021. I know it's a long time, but these things do take time.
Dr. Bharat Pankhania, as ever, thank you for your help and advice. And Jenny, briefly, we're going to talk to you at the end of the programme once more. But Jenny wants to collect a puppy from a breeder in Scotland to bring back to Devon. Can she? And if she can't, does she need to use a specific courier?
No, she can't. Scotland has a lockdown as well. But couriers aren't listed on the businesses that have to close, so she should be able to get one.
And let's just ask another quick one. Edward says, does he have to drive to the nearest supermarket, or can he drive a few miles further for a cheaper one?
As long as it's not too far, then that should be fine. We're supposed to stay local to our town or village, so that should be fine.
Jenny, thank you. More questions at the